Hello, my name is Neenu Sukumaran. I'm one of the internal medicine residents at Roger Williams Medical Center here in Providence, Rhode Island. And I'm happy to have this opportunity to bring to you our study regarding electronic health portal usage at a single center among Hispanic population and older adults. I am representing my team here, and this is a great opportunity to talk about diversity and what we find in our clinic practice as we go daily. So just a quick background on electronic health portals. These are valuable resources for the patient. They are basically a part of the electronic medical record, and it's a patient-facing window where the patient can see all their data, they can see all the test results, they can avail some of the resources through it. For example, they can look at guidances on how to manage their disease, for example, exercises or lifestyle changes, things like that. They are also able to download their medical information and share it to another practitioner if they are moving to another doctor or if they have a new consult somewhere. So this helps in kind of seamlessly integrating the patient care as things go on. Also, they are also very helpful for the patient to manage their day-to-day life. They can schedule appointments, manage all the appointments, and send messages to the provider or the care team. They can receive non-urgent messages, and all of this is in a privacy-protected healthcare setting. So basically, the electronic portals have been around for some time now, almost 10 years. In 2011, the usage of portals was around 12.5% among US adults, and it has increased to 25% in 2017. But this is still not enough. So the Office of National Coordination for Health IT has made some federal rules where they recommend that all people be given access to their health portals because they help in providing the patient a platform where they can manage their own health. So this is a part of the Cures Act 2021. And based on that, patients are available, the healthcare providers are required to provide the service to the patients. The electronic health portal basically augment communication in a privacy protected healthcare setting. This can be accessed through computers, or there are a lot of smartphone apps available today, which patients tend to use. This is very crucial in areas of medicine where we follow the patients long-term. For example, in rheumatology practice, where we would follow them for decades or even through their lifetime. And these portals have been proven to reduce healthcare costs and improve patient outcomes. So like we discussed, what we can do through the portals. They are a patient-facing window, like we said. Patients can send and receive messages. They can request refills for medications, which is very important for the patient. It helps maintaining patient compliance. Patients can view their test results. For example, if somebody is looking at their cholesterol, they can see what it was 1 year ago and what it is now, what they can do to improve it. So it helps them keep track of everything. They can access link to various educational resources and so on and so forth. We have some data from Health Information National Trends Survey, HINS, which is a nationally representative survey of US adults conducted from January 2020 to April 2020. Although this is at the start of the pandemic, the data is mostly reflective of the pre-pandemic levels of usage. So we found that they found that about 6 in 10 individuals nationwide were offered access to patient portal, and nearly 40% access their records at least once in 2020. Nearly 4 in 10 patient portal users used a smartphone app to access their healthcare record. And individuals encouraged by the healthcare providers to use their patient portal accessed and used their portal at a higher rate compared to those who are not encouraged to do so. So about a third of the patients also downloaded their health information and transmitted them to another healthcare provider. So aim of our study was to identify active users of electronic health portals from a single community academic rheumatology practice in Providence, Rhode Island, and understand the characteristics of individuals who used or who did not use the electronic health portal. Thereby, we aim to identify barriers that may prevent patients from using this resource. So we identified 88 patients who were using the portal and 88 patients in the practice who were not signed up for the portal. We compared both groups for characteristics such as age, gender, primary language spoken, and ethnicity by chart review. We further analyzed the portal users by characterizing patients who logged into the portal at least once in the past 1 year. So these are our results. We found that because ours is a rheumatology practice, about 80% of our patients are female, which is because of the distribution of how rheumatological diseases affect women. About 1 in 9 women are affected more by rheumatological diseases compared to men. So this is not unusual for 80% of the women being in our practice. We found that around 85% of the people in our practice, both users of the portal and non-users, were English speakers, and only about 10 to 15 percentage were Spanish speaking. However, around 30% were of Hispanic or Latino ethnicity. And we also looked at the age distribution. So what we found was that usage of portal among females compared to males were comparable. There were about 50% of females used portals compared to slightly less than 50% who males who use the portal. Also among English speakers, the usage of portal was comparable with people who did not use the portal. And the same among, there was not much difference among people who were of non-Hispanic or Latino ethnicity. However, we did find a difference when it comes to people of Hispanic or Latino ethnicity. We found that there 53% of non-Hispanic or Latino patients use the portal, whereas only 39% of patients with Hispanic ethnicity use the portal. We also found a difference of portal usage when it comes to age. People younger than 50 years of age use the portal 76% of the time, compared to 40% who were over 50 years of age. So in the past year, around 66% of our patients who were in the portal users group have used the portal. They have sent at least one message in the portal. But of this, only 3.5% were Spanish speakers. And our clinic population, around 30% of the people were Hispanic or Latino heritage ethnicity. So 55% of the users who actually send at least one message was more than 50% of 50 years of age, which means that once the people who are older than 50 years started using the portal, they tended to like it and they tended to use it more. So our center is located in Providence, Rhode Island, and per the US Census Bureau, 10.8% of the population in Providence is more than 65 years old, and 43% of the population is Hispanic or Latino ethnicity. So this makes it more important for us to reach out to the patient population that we serve, which is an urban population. And this also shows just the number of the times that women are more afflicted by some of the common rheumatological conditions that we treat. And so we did find that patients of, in the study, basically what we found is that patients of Hispanic or Latino ethnicity tended to use the portal much lesser than patients who are of non-Hispanic or Latino ethnicity. And when we further looked into those groups, we found that patients who were older than 50 years of age only used the portal 87% of the time. This is in the Hispanic or Latino group. So the conclusion is that older adults of Hispanic or Latino ethnicity were disproportionately not using our electronic health portal. So we think that this is a disservice to them when there are so many facilities that they could avail, especially in this current pandemic. This would be a very easy resource for them to use. There are Spanish versions of the portal available as well as English versions of the portal. But the problem is that when the patient sends a message through the Spanish version of the portal and the provider is not well versed in Spanish, what do? Do we can we use a translator? What is a good method to do? We don't have a good method yet. So that is a big issue for us. We do plan to further on look onto this study. So we are planning a next phase where we plan to do an intervention. So we based this on the HIN data, which showed that once encouraged by a healthcare provider, the patients tend to access their healthcare record more often. They tend to view their clinical notes. They tend to send messages. So what we are planning to do is do an educational campaign at our clinic where we would print out flyers and hand it out to patients. Also, when we are seeing them, we would just take 2 minutes to just educate them about the portal so that they get it from a source that they trust, and they know that we are looking at this portal and we will respond to any of your concerns that you are sending our way. And also to send out text reminders. Sometimes people tend to lose their things all the way, and if they have it at one place where they can go back and just click on that link, so it's always easier for them. So we plan to send text reminders with instructions on how to register. And we also plan to enlist family members to help register people who are older or who are not that well versed with computers and such. So this is our plan for our next phase. Hopefully, we'll try to bridge this gap where we have found that our patients who are of Hispanic and Latino ethnicity and older than 50 years of age, they have less access to this tool that we have. And these are some of the references for this study. Thank you very much. And if there are any questions, I'd be happy to answer them. Thank you. So we are also looking for any collaboration. So if there is anybody who would wish to collaborate with us on this public health domain, we would love to talk to that about that more.
Yeah, thank you. I was just wondering if there are any questions on Zoom. Oh. Yeah, just wanted to check on Zoom if there are any questions from the participants. Okay. Any questions from the audience?
Yes, basically knows everything about this.
Yeah.
Absolutely no question. So I would like to talk to this friend here. Yes. What did you learn? Oh, I did learn that we could make a difference there. We have this patient, we identified this patient population. We didn't know that there would be so much of a gap with just 50 years old. It's not really that elderly when we consider 50-year age, right? But even with that much age group, there is a big gap where we can make a difference. And these people they have decades ahead of their lifetime. So, and they're still in a phase where most of them are active. They can still learn, they can still avail this opportunity. So I think it's something that we can make a difference in.
I just had a quick question too. So like, I was wondering if you have any evidence to actually, like, I'm more thinking, why is this important and how does this make a difference? So I'm wondering if you have any evidence on how access to electronic portals maybe leads to better health outcomes in the long run.
We had a couple of studies, national studies, which showed that once the patients start getting involved in their healthcare, they have a sense of ownership and they tend to follow through more well, because they would have this connection with the healthcare provider. If they have a question, they can easily ask it and remedy it quickly.
Right.
And also medication compliance is very important, especially in rheumatology. So we don't have anybody fall through the cracks where they don't have a refill for some time or things like that. We kind of avoid those things happening. And they feel closer to the provider and they feel closer to their own care. They tend to do other things well too, according to studies. When you look at your cholesterol number, it's going, oh, you should change your diet or you should exercise. So, and they feel happy when things come down, and it gives them a sense of control over what things are going on.
Questions? Okay. Okay, I think with that, we'll close the session and the week on social justice and health. And thank you everyone who has participated in the talks this week and with the very enlightening presentations you had, including the
Thank
one
you very much,
by
Archie.
Dr. Neenu. And yeah, and we'll see everyone next week on to discuss work on social justice and design. Okay, thank you.
Thank you, Archie.